Now we will finish this part with a very exciting session, at least for me, because it's not very often that you are invited to ask questions to colleagues that got technology themselves. And I must say also that there is something special with AcuFocus, because the first time I was introduced to that technology was through Ed Peterson's lecture. And at the end, he mentioned that himself he got an inlay in his eye. But as he was the CEO, I was maybe thinking in myself, maybe it's worth sacrificing one eye when you have this company. But still, it was very interesting. Then I met several people because I wanted to be one of the first investigators in France. So I was introduced to other people in the company, and believe it or not, most of them, provided they were priced by Hope, they had the inlay as well. So I was like, is this something that you have? You must have to be recruited in this company or what? No, I got convinced because I'm doing the surgery myself on other patients than myself, I mean. And I have very good results. But still, it's another thing when you are an ophthalmologist to get that technology, especially because I know some surgeons, they have LASIK, but LASIK is now 20 years old, whereas Kamra technology is much more recent. So the first question I would like to ask you is, how much did they charge you for the camera? No, seriously, you can keep it for you. The real true question is, each of you, could you please describe your vision before you got that camera implantation? Dean?
We're all a little bit different in this group, and I was probably the most different because I was quite hyperopic in the eye. I had an inlay put in, and around plus 1.75 diopters. My fellow eye is about plus 0.75, and I'm 48. So everybody has presbyopic symptoms at different ages. We all know it's tremendously variable. I know 56, 57-year-old friends that I have who have still fabulous near vision. So you can't taint everyone with the same brush. You've got to treat everyone as individuals. And with my refractions, I was starting to really struggle at work. That was the bottom line. My personal life outside of work was also a bit of a struggle, and I was becoming absolutely dependent on reading glasses at that age. But it was the situation of being at work as a refractive surgeon. As a surgeon that's treating people for presbyopia and myopia and hyperopia, and you're sitting there and you're fiddling with your glasses. I'm sure you've all been asked, Doctor, how is your eyesight? And I just couldn't sit there and see the results of my patients in the FDA trial. I've done 18 down in New Zealand, all doing so well, and not jumping myself. That's the sort of person I am. It's a personality thing. You've got to know what your patients are like. So I was starting to make mistakes trying to read numbers on charts. If somebody bought me some calculations to look at in the middle of a cataract operation, can I just check those numbers? I couldn't see them. So I'd dial up a little bit of plus in the left eye on the operating microscope, and basically all that's gone now. So I was struggling on a daily basis at work and in my personal life. Something had to change. And for a while there, I was thinking I was going to head towards a refractive lens exchange, but thankfully the camera came along and saved me.
Thank you. Robert?
Yeah. I was essentially a functional emmetrope. I had mixed astigmatism. I was minus 50 plus 1 in both eyes. And that basically, it was with a rule astigmatism, so I had pretty good near vision into my 50s. Over the last couple of years, though, I lost fairly well all ability to see anything up close. It would become very bothersome if I tried to read text on my cell phone or any details at all on my cell phone. It was really frustrating in the LASIK clinic when I would be docking the patient's eye. I would struggle with centration and just being able to see well enough. I needed much more light to be able to do this. So basically I found myself never having really worn glasses. I wore them for a little bit period of time when I was in my residency to correct that mixed astigmatism, but all of a sudden I had to wear glasses, and that sucks. I've got to tell you, I understand clearly what patients tell me now when they become presbyopic, that life takes on a different meaning. Driving down the road and my cell phone goes off and I can't see, who's texting or anything like this at all. Very, very frustrating. And as a surgeon, the thing that I was most concerned about is this going to affect my ability to operate adversely? I got to tell you, it has not, and I'm tickled. I'll be happy to answer any questions from you guys later on as well.
Thank you. Rick?
Well, Damian, even a slightly different position. I'm older than these guys, and at 59, and I'm a 6'4", 2015 emmetrope, and we're real hard bastards, and none of us will take any reduction in our distance vision. But my near vision at 59 and emmetropic is absolutely nothing. It's not a little bit, it's absolutely nothing. My near vision was so bad that I couldn't even get into the FDA trial if I wanted to, because there's a minimum level of vision. So I'm obviously a poor neuroadapter, I can't work it out, I just don't get it. And so for me, everything didn't work. I couldn't just go out for the day without taking a pair of glasses. Go to the supermarket, you go out in the boat, you can't see the GPS, you can see where you're going, but you can't do that, go fishing, whatever. I had to get kids to read things to me in the supermarket. That's really embarrassing, unless you take glasses. Now, there's guys around who can take a pair of glasses with them everywhere, and they know where they are, and there's 3 pens in their top pocket, and they're really organised kind of folks. But most people aren't like that, and I wasn't like that. And I had what I call the desperation of the emmetropic presbyope. It's a nightmare, because you don't wear glasses, you don't have multifocals, and I just had to do something, and having absolutely no near vision was my stimulus.
Thank you. So we understand through your eloquence that now you are all at near spectacle free, right? For most of daily tasks at near. But the question is, how about the distance vision? How did the surgery affect the distance vision?
I'm still, I'm a lot better. Plus 175 at 47 was at poor 612, and I'm 6'6" now, 6'5" on a good day, and it's quite reassuring to sit with the patient at 5 metres and say, using the Landolt-C or the illiterate E, so as they know you haven't memorised it all, I can read that, and I can read that up close too. So distance vision hasn't been a problem. For me, perhaps different to the other chaps, I still have a bit of binocular rivalry, and that's probably going to get worse as time goes by. But it's a fascinating thing to experience what you've learned about for a long time. But that's got less and less. For a period, I have to close my dominant eye to actually see better up close. But now it's not something I have to do.
All right.
No. Yeah, my distance vision is likewise good. I'm just a little over a month out of surgery, and I can tell if it's a dark environment. I still have a little bit of glare in my camera eye. It's getting better over time. One of the keys is not to go around doing the refractive salute, and when I find myself doing that, I'm slapping the hand. But it's all getting better, and I must say there are times that my camera eye actually sees better than my right eye for distance as well.
That's very interesting.
I mean, my distance vision was 6 and 4.8 minus 2 before, and I was plus 050 or minus 050, something like that. And my post-op vision was 6 on 4.8 as we measure it in metric. I got all the lines, so I gained 2 letters. But if I'd lost 2 letters, I would have been really angry. I would have been very upset. It's the kind of guys us emmetropes are. And I gained 2 letters.
Again.
The night vision changes, but you don't notice it because of the dominance effect.
That's true.
If I close my dominant eye, there's just this very, very faint soft focus around the lights. It's not like a halo, but it's just a soft focus. But that goes away.
But with both eyes open,
For me, the kind of ghost, the starbursty kind of things we've all got. they're just different in the two eyes. It's not worse in one or the other. They're just different.